New Smithsonian Channel original documentary chronicles how people of color suffer from systematically substandard health care in the United States and how COVID 19 exposed the tragic consequences of these inequities. Now, the film is called The Color of Care. Today, I've got Oscar nominated and Emmy winning director and producer of the film, Yance Ford, along with one of the featured participants of the film, Dr. Hetty Cunningham. Good morning to both of you.
Good morning.
Good morning.
Doctor, let's talk a little bit about the racial disparities in healthcare.
So, racial disparities in healthcare have been known about literally forever. A huge report called Unequal Care came out in 2003, produced by the Institute of Medicine. And disparities in care have been documented in all aspects of American healthcare, from curative lung cancer surgeries not performed, to kidney transplants not performed, to treatment of pain. And actually, the treatment of pain disparity is the most significant in children, in Black and brown children, which is quite concerning and shocking to me as a pediatrician.
Now, Yancey, I have to admit to you, there were several times when I was screening The Color of Care, I had to stop it and collect myself. Uh, it really hit home quite a bit. How did you come up with doing this film and talking to these individuals?
Well, I think that everyone knows that there's nothing more powerful than the human story, than individual stories that help us understand in greater detail some of the larger issues in our society. And we came upon the Fowler family because Ms. Winfrey read an article in USA Today about what happened to Gary Fowler when he sought treatment for care for COVID-19. But as we expanded the film and looked for other families, it became really obvious very quickly that there were many, many people around the country who had encountered inequities in trying to access care, and then had also received substandard care. And that was part of, one of the most difficult parts of COVID-19 was making sure that these individual stories don't get lost. So, the families that are featured in the film were all very brave and very kind in sharing their stories with us. And we hope that by sharing their stories, they will motivate us all to think more holistically about the healthcare system that we have in the United States and whether or not we all receive equal care.
Yancey, I would have to agree with you on that. Hopefully, that the people who view this film will actually think that. But, Doctor, this was going on for so long. Both of you, what can the community do? If it's not going to come from healthcare, what about the African American community itself or people of color themselves?
People of color can keep the spotlight on this issue, ask questions, um, advocate. Uh, you know, the Black Lives Matter movement has been so tremendous, and the students, the young people, have really led in many instances. We're finding this in our medical schools. The young people are at the forefront of change, and I think supporting um, these these movements, speaking up, voting, being active, and educating ourselves. And this movie is a tremendous educational opportunity to see what is going on and to get activated.
And James, there are also, African American doctors like Dr. Cunningham, but also like Dr. Ayla Stanford and the Black Doctors COVID-19 Consortium. These are examples of doctors who are stepping in, and actually, Dr. Cunningham's work at Columbia University and Dr. Stanford's work in Philadelphia, they are stepping in to fill in the gap. To close the gap between Black and Brown communities and quality health care. And I think that that's one of the things that is also a takeaway from the film, that Black and Brown doctors are stepping forward themselves to address this issue.
Yance Ford, Dr. Hetty Cunningham, thank you so much for joining us on Morning Blend. And this is going to be airing on Smithsonian on May 1st and then streaming on Paramount Plus. But to both of you, it really shocked me. I am African American, but the history that was shown of the experiments done on slavery women was just too much for me. I did not know that. I'm pretty sure there's a lot of other people that didn't know that. Thank you again for this film.
Thank you.